Hi, this is Bianca Martinez, and I'm going to be making a video for our week 4 assignment. Our first question for the critical thinking, my response is based on my first impressions of the patient being brought into the ER by EMS, I believe she is suffering from dementia. Dementia affects one's memory, thinking, and social skills, affecting their everyday life. The patient agitation and paranoia are also common psychological changes to one suffering from dementia. With the patient being brought in, the individual that called 911 let them know that she found a woman wandering lost, looking confused, and then the patient got really agitated at that, and that's when they said she fell and scraped her arm and started bleeding. The EMS was saying while there she was swinging, was still extremely agitated and kept telling them that they took her purse. When she was in the ER, she was saying she wanted the bottle, which seeing the confusion, agitation, it kind of led me to believe that she was suffering from dementia, and also from the body odor she was experiencing. It is very common that people with dementia, if they don't have any support system or get help, it is really common for them to become homeless. That reason, they can easily, how I mentioned, dementia affects one's memory or just process things to remember their daily things that they're so used to doing, like paying bills. They can get far behind, leading to them to become homeless. For the second question, I replied, dementia can progress quickly. Some tend not to notice the early signs, such as cognitive function will begin to decline. It can begin to affect their speech and language, memory, and problem solving. Usually, if an individual notices early signs, if they bring it up to the doctor will make a note of it, and they tend to monitor the symptoms for about 6 months before they start suspecting if it may be dementia or anything else. Dementia can also affect one's behavior, just like the patient being brought in. She not only seemed confused, but she was extremely agitated, accusing people of taking her items, wanting us to give her random items back to her. She didn't want anybody touching her. And myself, I worked in a nursing home. It's been about 5 years now, and I had patients that they had dementia. They recognized me. They were the most loving patients ever. And there would be moments that they would forget who I was and become agitated, and they didn't want me helping them. So that is where the behavioral will start to affect people with dementia. If the doctor catches their early symptoms, like I said, they'll monitor it for about 6 months before coming to a diagnosis or suspecting dementia. Not only the behavior and agitation, you from family members or just people that are familiar to you may start noticing those behavioral changes, just as being more irritated, agitated, things that they're so used to doing everyday things, or even places they may go to every day, such as work. They may forget how to even get to work, or may forget where they place their keys every day, that they'll become extremely agitated because they can't find or know how to get to that location that they're trying to get to. For question 3, I suspect the reason the patient has those jerky movements at first, before really thinking of dementia, I suspect that she has Parkinson just from her body shaking, sort of like the tremors. But the more I looked into researching dementia, I realized that there's different forms, not just Alzheimer's. So the type of dementia I suspect the patient was having that was causing these body tremors is Lewy bodies dementia, which accounts for 15 to 20% of the late onset dementia. That is usually caused by protein clusters that will accumulate in the patient's brain. This form of dementia, the Lewy body, tends to progress extremely quickly. Patients can experience hallucinations. It is common for those to have slow, uncoordinated movements and tremors similar to Parkinson's, so that where it may confuse some individuals and suspect them of having Parkinson's instead of Lewy body dementia. Question 4. I believe that doctor is likely to order a screening for the cognitive impairments, also a comprehensive assessment. That way they will be able to check the patient's language, communications, their memories, their cognitive functions, just as I do on the previous assessment. And I believe they will also be checking their hearing as well. For the recent question, mental illness and the insurance coverage, I believe mental illness can be covered with both, is covered or treated with both therapy and medication. Traditionally, insurance benefits for mental health has more benefits for medical than surgical services. They do treat it, but I believe it, or from experience, I've heard that they only cover a certain amount of hospital stays that the insurance will cover. If not, the patient will have to pay out of pocket. Some health insurances may offer discounts on the mental health medication. The Affordable Care Act requires that your health plan cover mental health equally to other treatments. I learned is called mental health parity. It is also possible that your doctor can help prescribe a less expensive brand or may even be able to provide you with samples to try out. There are also some government programs that will, such as Medicaid or here in Arizona, for the low-income families, they're able to afford access, and that tends to fully cover their medications and health treatments if they qualify